anchoring point, and I'll try to get some, like a stretch right through here. How's that feel?
It feels amazing.
Yeah, so what you're doing is you're taking the lower back. So, just talking about her lower back was bothering her a little bit earlier today. And so I want to show a quick way to help your loved ones in their lower back. You want to be careful not to apply too much pressure in certain areas of the back, yeah? The sacrum is that triangle-shaped bone that's like right above the the tailbone. There you go. Right above the tailbone, and then you get into the lower back. So there's this area that you really want to be focused on, and it's important that you find this. Anything above the waist, if you apply pressure into this area, it can be really uncomfortable because you have your floating ribs through here, you have your kidneys down inside there, and there's not much bony tissue or bone to press into to give yourself a good some good pressure or good stabilization or anchoring point. So what you want to do is, one of the things I like to do is, I like to get my hand going in this direction towards the head slightly. And while I get that going, once I get to that tissue where it's kind of taut and I'm right at their upper back almost, mid-back almost, I'll anchor the heel of my hand right at the sacrum because that's a really strong anchoring point. And I'll try to get some, like a stretch right through here. How's that feel?
It feels amazing.
Yeah, so what you're doing is you're taking the lower back and its natural curve, and you're opening that back up or bringing the lower back up towards you by doing this. So hand goes this way, you get that tissue nice and taut, and I like to press just a slight bit, and then I put pressure down on the sacrum, and I'll almost take my hands and I push them away from each other, yeah? And that provides a really good stretch for the lower back. Another thing you could do is if you kick over your yoga blocks, tends to work pretty good. Other thing you can do is from the top of your person's shoulder here. This makes this a lot easier if you just come up from this angle, right? So that you get this nice diagonal right here. So I'm at her shoulder. This is really important to be able to get a good anchor from this point. And I'm still doing the same thing. I'm pulling some traction this way, right across the body on the opposite side now. How's this feel?
It feels so good.
Yeah, it feels good, right? So it's like I'm taking tissue, pulling up towards the shoulder. Now be careful, because you don't want to get under the shoulder blade and start pushing their shoulder up, because then all of a sudden you're cranking their shoulder up to their neck, and that's not going to feel comfortable. So usually I'll find that area right across the middle of the back where the rib cage is at its highest point, and I'll just drag the skin back. Try not to be digging all into their shirt and pulling. It's just a slight gradual pull. And while I hold that distance or that position, I'll anchor right at the sacrum again and apply some pressure. And that usually feels pretty good. You can, from this point, you can go back across the body. I'll do the same thing where I drag shoulder away from the hip, and then I push the hip away from the shoulder. How's it feel?
So good.
It feels really good because it's just taking your aponeurosis, aponeurosis, I'm gonna put it up on the screen and I'll let you pronounce the drain. You can tell me, leave me a voice message on how to pronounce it. But there's this big tissue, this band of tissue called aponeurosis. I'm not gonna put that stuff in there.
So funny.
I'm not gonna put that in there. I know, it's so stupid. So for those of you who really don't have the flexibility in your knees and your hips to get down on the floor like this, one of the things that you could do to get much more support is to take half stance, half kneeling, and you can do everything from this position here. So same thing, drag tissue, anchor, boom. Feel good?
Mm-hmm.
Same thing. If you want to give yourself even some more position so that you can get a really good, some good balance here. Some people don't have a lot of balance in their lateral core. So you might need to do it this way. Boom. And what this does is it allows you to move around a lot better and to kick over your foam roller. That's super important. You do it this way. This really gives you a lot of control over where you can go. Another thing that you can do from this position is, since you're here, and I'll tell you what I'll do is I'll just change my leg position here, is really put good pressure right down on the hips here. Like if you're going to try to work the glutes, which, because your glutes tie right into your lower back, it's always good if you're going to work with the glutes or the lower back to work on the person's glutes. And so I've got a stabilizing hand on the sacrum. Heel of my hand is right in the fossa of the pelvis there. I'll do it from this side so you can see it. So sacrum here, heel right in the fossa of the pelvis, and I just rock into the pelvis. And instead of just like putting, again, what I refer to as like dagger pressure, I don't like to go straight down in with the sharpest points of the bone. So what I'm doing is I'm kind of just rolling my hand down the hip. So I start closest to the right or the center line, and I just roll my hand outward. And once you get to this bone, and you'll be able to tell where the greater trochanter is, it's like the hip bone. That you've got the crest of your pelvis up here. This line is the top of your pelvis. But then right to the hip, you're going to have this bone right here, and that's called the greater trochanter. It's important to know where these little bony points are so that you can get oriented properly. You can just press right around the greater trochanter because you have so many muscles that tie in there. Babe, how's that feel?
So good.
Yeah. So this stuff gets really congested around these areas. And so I'm taking my two thumbs right on the trochanter. Your piriformis attaches here. Your obturators, they tie into here. The internal and external obturators, they all attach here on the greater trochanter. And you got a couple of other muscles that run through here. But this is one of the easiest ways to work the glutes because you don't have to do too much work. You let gravity do all the work. And if I really want to use some extra pressure, I'll go heel in. This is one of those super duper pro tips. Knee to the outside of the elbow, and use your leg to apply more pressure so that you're not using the muscle in your shoulder. So I'm using my knee on top of my elbow, and that allows me to use my body weight in a more efficient way. So again, elbow right inside there, boom. Gives you a lot of, you feel okay?
Yeah, actually.
Yep.
When you're working someone's lower back,
Mm-hmm.
is it necessary to also work their glutes?
It's not necessary, but I mean, it's good to do it because the glutes tie directly into that band of tissue across the lower back, and we'll put it on the screen. And then you have your lats that actually tie into that band of tissue. So what you have is this contralateral situation where if the glute gets tight, if one of your hips gets tight in the front or the back, it can have an effect on the opposite shoulder, which, if anybody knows anything about the kinetic chain, that's just the way it's going to work out. So does that answer your question? Do you have to work the glutes if you work the lower back? I would recommend you do it because anything across the center line of the body is going to benefit from that. So if I get my wife to turn over, I'm going to stretch her lower back for a really quick stretch. This one is a good one. This is one of those ones that you, hey baby, scoot down this way for me, just peek down this way. Perfect. Let me see what we got here. Let me turn that up, this one up. Super bright? Yeah. Sorry. All right, so am I blocking it there for you?
Yeah.
Good, okay. So this stretch right here is really good for the lower back. I don't know if I'm sitting up too high. Hopefully my big head is still blocking the light.
Yeah.
All right, so I'm gonna take outside forearm right across the knees, hands under the feet. So one hand under the feet. Hopefully you got big hands like me. It's like, no, I'm so sorry. I'm taking that out. So if you take your hands and place them on top of your feet, no, take your feet and put them on top of your hands, and then your forearm on top of the knees. What you can do is you can have your person draw their knees into their chest, nice and strong.
That is so good.
Give them a nice, so if you have them to draw their knees into their chest, it's gonna just invoke. And all I'm doing is just pressing slightly. I'm not doing anything spectacular. A little bit of pressure. You getting pressure in your hips?
No, it's just,
You want to go more?
if I were to do that myself, I don't get that pressure.
You can't get the same pressure because when you have to activate muscles, you can't take advantage of some of the things in the body that happen. So we'll talk more about that, but these are really important, all right? So let's do this stretch a little bit more. She's gonna let go of her legs so I can work, and then she's gonna move her hands so I can go in. There we go. And we're gonna press a little bit more. Now what we're gonna do is we're gonna have her really draw her knees in, and instead of going here, I'm gonna switch hand to lower back under. And it should start taking the stretch up the back, okay? So same thing, gonna catch her hands, catch her feet. I'm gonna catch her feet in my hands, press here. I'm gonna switch right up under. Boom, nice and easy. Pressure, lift, and she should feel a good stretch in her back as she's going up. And now just keep her drawing her knees into the back. This is something called active isolated stretching. A lot of people, they use a lot of different types of stretching techniques, but I found this one to be superior. How'd that feel?
It's good. The
Yeah.
lower back felt better than the mid back.
Oh,
But
so,
they both feel okay.
okay. That's good to know. So you gotta get your feedback. So I'm gonna have her to draw her knees back up again, and we'll show you what she just now told me. So she said the lower back felt better than the middle back stretch. So all we're gonna do is just stay in this place, have her to draw her knees in really tight, 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 tight. Because when she activates her abs, reciprocal inhibition kicks in, and the lower back can then be properly stretched. And again, we'll talk more about reciprocal inhibition. If you want to be a super student, go look that up. See if you can understand that before we talk about it next time, okay? But this is a great stretch for the lower back. Make sure you tune into our next video where we talk specifically about reciprocal inhibition and why that's a principle that you could take advantage of and almost exploit to help the body to get to a better place much faster. You happy? No, you good.